And at times when they come to hospital, when you want to dress that kind of wound, you'll be surprised the magnitude or gravity of bleeding you'll be seeing, because there are too much blood vessels around the wound, because they form their own blood vessels, what they keep. So anything you touch, you see blood. Lord. That is why it's not advisable that people, when they see tumor, they cut it. Sometimes when you cut it, bleeding will not stop.
It might be cancer.
So that is actually what is happening at the cellular level. And when now they regroup and become tumor, the problem with cancer is that they don't just stay in that particular place where they start. For example, they start in the breast. Before you know, you see them inside the lungs. They move around through the blood vessel or the lymphatic vessel. They'll go and deposit 10 criminals there, and those 10 criminals will start regrouping again. They divide at will, and you see that from breast cancer now you see lung cancer.
This is just like a slave that has been free, so he can just move all around anyhow.
Before you know, you see them inside the bones. People start complaining of severe back pain. Before you know, they move around. Before you know, you see them in the brain and become. So that is what we call metastasis. That's the spread. So that is cancer. That is the uniqueness in cancer, where it starts. It does not confine itself to there. They can move to other parts of the body. That is what we call metastasis or cancer spread. Yes. So that is actually what is happening at the cellular level. In summary, Rachel.
All right. This is very dangerous, actually. Very, very dangerous. All right. So moving ahead, the major risk factor into this world, based on current research, what are the most significant modifiable and non-modifiable risk factors contributing to cancer incidence today?
Well, as you know, generally cancer, that is one bad thing with cancer. It has no specific cause. That is a problem. When you ask what causes this cancer, so we don't know. It's idiopathic. It's unknown. But as you mentioned, there are some factors we call them risk factors or predisposing factors, that when an individual experience or is practicing certain practices or having those factors, there is high tendencies of he or she to develop cancer. Yes. And mark you, these cancers are of different types. Cancer is not one type. In fact, every body part can develop cancer. You can see cancer in the breast, you can see cancer on the skin, you can see cancer
on the eye.
Even on the eye. You can see cancer around the head and neck. You can see lung cancer. We have liver cancer. We have a gastric cancer. We have colorectal cancer. We have prostate cancer. You have cervical cancer. But we have the most common cancers we have in Nigeria is the breast cancer, cervical cancer, colorectal cancer, and prostate cancer. These are the four most commonest cancers we have. So two is more of feminine, the women, the breast cancer and the cervical cancer, while the other two could be men or women. The prostate cancer is mainly men. You cannot see prostate because women do not have prostate gland. So prostate cancer is mainly for men, while colorectal cancer can happen to a woman or a man. So every body part can develop this cancer. So the modifiable risk are those risks that you can be able to do something about. Are you following?
Yes.
So, and the non-modifiable risk are the risk that you have no control over. Let's start with the modifiable risk. For example, alcohol intake. Excessive intake of alcohol is a modifiable risk. Smoking is a modifiable risk. Physical inactivity, sedentary lifestyle, is a modifiable factor. Are you following?
Yes,
so you see all this that I have mentioned, you can be able to do something about them. Is it just to quit smoking? You are good to go. Stop taking alcohol. You are good to go. Then engage in physical exercise. You are good to go. But if you observe, or you are the type that you smoke, you take alcohol, and you don't exercise your body, of course your chances of the risk is high in that particular individual. Because there is high relationship or high affinity between cancer development and those factors I have mentioned, especially smoking. There is great relationship between smoking and development and cancer, be it cervical, be it prostate, and many other cancers. Are you following?
Yes, sir.
So the modifiable factors are factors that you can be able to control them, you can be able to quit, you can be able to stop practicing. While the non-modifiable risk are those risks that you have no control. For example, you are a lady. Being a lady alone is a risk factor for development of breast cancer. Because we usually see breast cancer more in women than men. About 99% of breast cancer happens to women. So you see, being a woman, being lady sex now become a risk factor for the development of breast cancer. Another risk is age. It's when you grow and reach maturity that you have breast tissues developed. It's hardly to see a breast cancer in a small child girl. It's hardly to see that. You must grow, reach maybe the age of maturity, poverty before you, and most at times breast cancer happens to older women. 35 years and above. Yes, so you see age now become a risk factor for development of a breast cancer. Another one is a family history. If there is family history of breast, you have no control of belonging to a family. You may belong to a family where they are having cancers, be it breast, be it any form of cancer. So there is family history of breast cancer or any form of cancer that gives high chances of an individual to experience cancer too in their own lifetime. And then personal history is also a risk. If the right breast develop breast cancer, there is high chances to affect the other breast if care is not taken.
Okay, please, can I cut you here?
Yes.
Okay, if the left one or the right one, anyone that is been affected and been cut off, do cut off due to cancer whatsoever.
Yes, of course, we call it mastectomy, removal of the breast tissues.
Alright.
Yes.
So does it mean that afterwards, cutting whatsoever you called, and then this one's too?
Why do we cut? We cut because we don't want the other one to get affected.
Yes.
That is why we cut. That's why. So now, if the right breast is affected by cancer, there's high chances for the left breast also to develop cancer. So you see how personal history can lead to a risk factor of developing cancer. So if an individual has a breast cancer from the right side, when you come and we establish this is a cancer and it has reached certain level, certain stage, after some, when we come to talk about the treatment modality, maybe we talk about that one. If they ask to remove the breast, it's actually good for you to agree that they should go ahead and remove the breast. It's better. They're just trying to reduce the risk of spreading to other parts, especially by affecting the other breast. I think it's better having one breast than completely losing the breast, and it's better to lose all the true breast than to lose the life. Yes, maybe you have small children, and you can reconstruct breast. This is different topic. What you said. We can construct breast. Very well. We can remove breast and reconstruct another one for you, depending on which size you want.
Silicone. No.
That is solution. Yes.
All right. So moving ahead, can you help us to get to know what are the signs and symptoms of this cancer, be it from the breast, be it from all the cancers, all the name of the cancers you got. Let me not call it the name of any other thing. Because
well, let's signs and symptoms. I hope you know the difference between signs and symptoms.
Yeah.
What are the difference between signs and symptoms when we say these are signs?
Okay, these are signs signs. Probably, let me start with kata. Let me give you an example of kata. For me, my signs of kata is when I start feeling weak. Giving the example, when I start feeling weak and then probably slight headache, that's a sign to tell me that actually something is wrong with my body. And then when the fluids start coming out and whatsoever that's the symptoms, and then that when I get to know, okay, this
Okay,
is
Rachel,
this is it.
based on your understanding,
Yes,
well, it's very simple. Signs are those things that we can see clinically if you come. So now, when you start feeling weakness and headache, you know, those are symptoms.
Oh,
Because
okay, I switch it.
Yes, what you complain to us is symptoms.
Okay.
But what we see
Is the
clinically is there are
Is
signs.
signs.
So those signs and symptoms depends which cancers are we talking about. Are we talking about breast cancer? Are we talking about cervical cancer?
All right, now,
Are we
so
talking
let's
about
go.
prostate cancer, or are we talking about colorectal cancer?
Let's go to breast cancer.
Okay,
Is